Hello and welcome. Today we're going to explore a very important topic, kidney failure. We'll break down what this condition is, look into the different reasons it can happen, and answer a crucial question: can kidney failure be reversed? Understanding this is key to managing your health. Welcome to our channel. Our mission is to make complex medical information easy to understand. We believe that when patients and their families have clear, simple knowledge about health conditions, they feel more empowered and can make better decisions together. We're here to support your health journey. Let's start with the basics. You have two kidneys, each about the size of your fist. They are located on either side of your spine, just below your rib cage. Think of them as your body's master chemists and purification plant, working tirelessly to keep your blood clean. The main job of your kidneys is to filter your blood. They remove waste products, toxins, and excess fluid that your body doesn't need. This waste is then turned into urine and passed out of your body, a process that happens around the clock without you even noticing. But that's not all. Your kidneys are multitaskers. They produce hormones that help control your blood pressure, make red blood cells, and keep your bones strong. They also carefully balance important minerals in your blood, like sodium and potassium, which are vital for nerve and muscle function. So, what is kidney failure? It's a condition where your kidneys lose their ability to filter waste from your blood effectively. When this happens, the kidneys can no longer perform their essential functions, leading to serious health problems if left untreated. It means the body's cleaning system is breaking down. When the kidneys fail, dangerous levels of waste and fluid can build up in the body. Instead of being removed as urine, these substances remain in your bloodstream. This buildup can throw your body's chemistry out of balance and affect every single part of your body. This buildup of waste can cause a range of symptoms. You might notice swelling in your legs, ankles, or feet. You could feel unusually tired or weak all the time. Other signs include feeling sick to your stomach, losing your appetite, or having trouble sleeping. It's important to know that kidney failure isn't just one single condition. It is broadly categorized into two main types, based on how quickly it develops and how long it lasts. These are called acute kidney failure and chronic kidney failure. Let's look at each one. Acute kidney failure, also known as acute kidney injury, happens suddenly and rapidly. The loss of kidney function can occur over just a few hours or a few days. It is often seen in people who are already hospitalized, particularly in intensive care, for other serious conditions. There are several common causes for this sudden decline. It can be triggered by a severe infection, major blood loss, or serious dehydration. Certain medications that are toxic to the kidneys or a sudden blockage that stops urine from leaving the body can also lead to acute failure. Let's consider the story of Richard, a 62-year-old man. Richard was generally healthy, but he developed a severe case of pneumonia. The infection spread, and he became very dehydrated because he was too sick to eat or drink properly, leading to a sudden drop in kidney function. In the hospital, Richard's medical team acted quickly. They treated the underlying pneumonia with strong antibiotics and gave him fluids through an IV to rehydrate his body. This helped restore blood flow to his kidneys and allowed them to begin healing from the acute injury. Richard's story has an important lesson. Because the cause of his acute kidney failure was identified and treated promptly, his kidneys were able to recover most of their function. With acute kidney injury, there is often a good chance of recovery if the underlying problem is fixed quickly. Now let's talk about the other type, chronic kidney failure, more commonly known as chronic kidney disease or CKD. Unlike the sudden onset of acute failure, chronic kidney disease is a gradual loss of kidney function that happens slowly, often over many months or even years. The two leading causes of chronic kidney disease are by far diabetes and high blood pressure, also known as hypertension. Over time, high blood sugar and high blood pressure can damage the small blood vessels in the kidneys, making them less effective at filtering blood. While diabetes and high blood pressure are the most common culprits, they aren't the only ones. Other conditions can also lead to chronic kidney disease, including genetic disorders like polycystic kidney disease, autoimmune diseases like lupus, and recurrent kidney infections or blockages. Now let's look at Maria's journey. Maria was diagnosed with type 2 diabetes in her 40s. For many years, she managed her condition, but over time, the high blood sugar levels began to take a toll on her kidneys, causing slow but steady damage. Maria didn't feel sick at first, but her routine lab tests showed a gradual decline in her kidney function year after year. Eventually, her kidneys became so weak that they could no longer keep her healthy, and her doctor told her she had reached end-stage kidney disease. At this stage, Maria needed a treatment to do the work her kidneys could no longer do. This treatment is called dialysis. Dialysis is a life-saving procedure that artificially filters waste and removes extra fluid from the blood, essentially acting as an external kidney. So, to recap the key difference, acute kidney failure is a sudden, rapid event, like a storm that hits quickly. Chronic kidney failure is a slow, progressive decline over a long period, like a river slowly eroding its banks over many years. This brings us to a critical question. Can kidney failure be reversed? The answer truly depends on the type of failure and its underlying cause. The outlook for acute failure is very different from the outlook for chronic disease, which is why distinguishing between them is so important. In cases of acute kidney failure, like Richard's, the kidneys often have the ability to heal and recover. If the cause, such as dehydration or an infection, is treated successfully and quickly, kidney function can return to normal or near normal levels. Prompt medical care is essential. For chronic kidney disease, the story is different. The slow, progressive damage that occurs over many years leads to scarring of the kidney tissue. This damage is generally considered permanent and cannot be reversed. The focus of treatment shifts from cure to management. While we can't reverse the damage of CKD, we can manage it. Treatments aim to slow down further damage and manage symptoms. This includes medications to control blood pressure and diabetes, dialysis to clean the blood, and for some patients, a kidney transplant. Because chronic kidney disease develops so slowly and silently, early detection is the most powerful tool we have. Finding the disease in its early stages gives doctors the best chance to slow its progression and protect the kidneys from more severe damage down the road. While early CKD is often silent, some warning signs might appear as the disease progresses. Pay attention to persistent swelling in your legs, worsening fatigue, or changes in urination, such as foamy urine. If you notice these, it's important to talk to your doctor. You can take active steps to protect your kidneys. If you have diabetes or high blood pressure, managing these conditions is the single most important thing you can do. This includes following a healthy diet, getting regular exercise, and taking your medications as prescribed by your doctor. Be mindful of the medications you take. Certain over-the-counter pain relievers, known as NSAIDs, can harm the kidneys if taken too often or in high doses. Always read labels and talk to your doctor or pharmacist about which medicines are safest for you. Regular checkups are vital, especially if you are at risk. Your doctor can order simple tests to check on your kidney health. A blood test measures your creatinine level to estimate your filtration rate, or eGFR, and a urine test checks for protein, an early sign of kidney damage. It cannot be stressed enough. Many people with early-stage kidney disease feel perfectly fine. You can lose a significant amount of kidney function without having any symptoms at all. This is why it's often called a silent disease, and why screening is so important. Finding and treating kidney disease early can make a world of difference. While we may not be able to reverse the damage, we can significantly slow down its progression. Working closely with your healthcare team allows you to preserve your remaining kidney function for as long as possible. A diagnosis of kidney failure can be frightening, but it's important to know there is hope. With modern treatments like dialysis and transplantation and good medical management, many people with kidney disease are able to live long, productive, and meaningful lives. Our key message today is that knowledge is power. Understanding your condition, the difference between acute and chronic failure, and the steps you can take to protect your health empowers you to be an active partner in your own care and make the best decisions for your future. Thank you for taking the time to learn with us today. We hope this explanation was clear and helpful. If you found this video valuable, please consider sharing it with friends or family who might also benefit from this information. Stay informed and be well.